Trading Company, I'd like to welcome all of you for attending our event today. Ladies and gentlemen, if I may introduce NewJersy International Trading Company. NewJersy International Trading Company manufactures its products at a 50,000 square foot building in northern New Jersey. And it has been a natural products company for a good period of time. The company has been developed into a model of modern tablet, capsule, and powder production. Granulators, tablet compressing, capsule filling machines, and coating plants can be seen in operation every day. NewJersy International Trading Company offers the following: diverse product range, vitamins, minerals, herbs, dosage form selection, tablets, capsules, time release. Tablet coating, natural clear glaze or color coated. Package and label development. Up-to-date raw material selection. Complete quality control system. Government licensed and inspected facility. And fast, reliable fulfillment of orders. All of NewJersy's products are manufactured at a USA FDA approved facility. And now, I'd like to give the floor to our main host, NewJersy International Trading Company, represented by its president and CEO, Dr. Mohammed Sabah.
Thank you, Mike. Good morning, everyone. Ladies and gentlemen, I would like to welcome the USA Embassy, represented by Ms. Diane Johns, the U.S. Deputy Commercial Officer. Also, Ms. Rania Mikhail, a commercial specialist from the USA Embassy. I would like to thank the American Chamber of Commerce, AmCham Egypt, and Jordan for their continuous support. Also, I would like to take this opportunity to thank NewJersy International Trading Company's agents in the region. Alliance Scientific Bureau, Iraq, represented by Dr. Mazen Abdarrida. Ma'in Drug Store, Jordan, represented by Dr. Mahmoud Zobi. NewJersy Cairo, Egypt, represented by Dr. Mohammed Farouk and Mr. Mustafa Taya. Doctors from Iraq, Jordan, Egypt, and our distinguished guests for attending our event. As most of you may know, that some of the MENA region countries, such as Egypt, Jordan, and so on, signed a free trade agreement with the United States of America. The question is that how can we benefit from those agreements in the region, in spite of the huge help that we get from the U.S. governments, represented by its embassies in the MENA region? We are, as a private company, has a little knowledge in this field compared to the tremendous knowledge that the professionals from the U.S. embassies have. And now, Ms. Johns, the floor is yours. Please welcome Ms. Diane Johns from the USA Embassy, Cairo, Egypt.
I'd like to welcome you all and thank you for taking the time out of your busy schedule to join us today. The purpose of today's gathering is to launch NewJersy International, a U.S. company, into the regional markets. The U.S. Foreign Commercial Service and the U.S. Embassy in Cairo is keen to work with Egyptian businesses to increase their ties with American companies, as well as support commercial activities between our two countries. Bilateral trade between the United States and Egypt reached over $6.5 billion in 2013. And Egypt is the third largest market for Egypt's the third largest market for the United States in this region. U.S. companies are interested in doing business here. They know there are opportunities and they're optimistic about Egypt's future and its potential for growth. Egypt has traditionally been an attractive market for U.S. companies. thanks to its strategic location, offering a platform for commercial activities throughout the Middle East, a population of over 85 million, and a GDP of $257 billion. New Jersey International Trading Company is a dietary supplements company doing business in the MENA region. In fact, just 2 weeks ago, Dr. Mohammed was a guest speaker at our Commercial Services Regional Strategic Planning meeting in Jordan, where he spoke about best practices in providing U.S. commercial assistance to U.S. companies in terms of regional integration. My colleagues throughout the region from the Commercial Service U.S. Embassy sections, and I greatly appreciated Dr. Mohammed's insights. And it's especially a great pleasure to be able to speak on behalf of his efforts in the region. It gives me great pleasure to congratulate Dr. Mohammed and New Jersey International Trading Company on their launch into the regional markets, and I'd like to convey my best wishes for a successful business venture. Thank you.
Thank you, Ms. Jones. Thank you very much. And now, if you allow me, we're going to talk a little bit about our company. It's going to slide off Maggie, which is highly appreciated. She gave a full picture of our company and our products. Now we're going to speak a little bit about our product, and if anybody has a question or any comments, they are more than welcome to. Our products mainly, as all of you know, my agents, of course, they know that, but we have some doctors from Iraq, from Egypt. They didn't know that much about the company and the products. That's why I want to explain a little bit about it. Our company mainly manufactures natural products. Nowadays, the concept of the pharmaceutical is different than 10, 20, 30 years ago. If you tell someone nowadays, oh, we're dealing with dietary supplements, they will go, okay, and instead of vitamin C, I will take an orange. Thank you very much. Now the concept is completely different. Our products are not just a dietary supplement, they are natural treatment. When I say natural treatment, it is natural treatment. In the past, used to tell you, if you take this tablet or capsule, if it doesn't benefit you, it's not going to harm you. Meaning, take it or not, it's not going to affect you. Now we see more than 63% of the Middle Eastern population, they are affected with vitamin D3 deficiency. That's what I call disease. That's what I call chronic disease. That's what I call it needs a treatment. That's what I call it's urgent. So we want to make sure that everybody understands the role and the benefits of those natural products. For an example, there's a chronic disease. It's all over the Middle East, maybe some part of the world too, North Africa, Europe, the States. It's IBS. All of us know what's the problems that IBS could cause. IBS, it's irritable bowel syndrome. Irritable bowel syndrome with related symptoms such as constipation, diarrhea, gases, and unpleasant causes. Most of the people in the past, they used to take for it anesthetic tablet or capsules. Okay, it relieves you for a few hours, 6 hours, 7 hours, then it comes back again, then you have abdominal problems, IBS movement, uncomfortable side effects. Then it will do it again. We came up with something called NewJersy Multi-Dophus. This product is completely natural, without any chemicals, without any side effects. This product's ingredients are Lactobacillus acidophilus, Lactobacillus bulgaricus, Lactobacillus thermophilus, Lactobacillus salivarius, and Bifidobacteria bifida. Those strains, as a combination, it forms 6 billion live cells that could get into your digestion system. Why it's important? Now, if we want to know the treatment, first we have to know the cause. What is the cause of irritable bowel syndrome, IBS, colon problems, gases, constipation, diarrhea, and all of these things? The cause is very simple. We have two kinds of bacteria in our body. We call it normal flora and bad flora, meaning good bacteria and bad bacteria. As much as your body needs to get rid of the bad bacteria, as much as your body needs to reinforce your good bacteria. Now, we want to make a balance. The good bacteria in your body defends your immune system, the IBS, and all of the discomfort that you feel. The 6 billion live cells that accrued in our capsule, when it goes to your digestion system, it goes around in your digestion system and sees where are the bad bacteria. It fights them and it replaces them, and then you get rid of the problem. That's what we call bacteria balance. From bacteria imbalance to bacteria balance. Let's put it this way: an army of 1,000 soldiers is fighting an army of 10 million soldiers. Who's going to win? Of course, 10 million soldiers. If you have in your body bad bacteria of 10 million strains of bad bacteria, 100,000 strains of good bacteria, there is no balance. We have to high-rise the good bacteria to be able to fight equally the bad bacteria. Then the good bacteria wins as the big amount of soldiers, replaces it, and then you'll get rid of the problems once and forever. Okay? Now, what causes IBS? That's a very important question. What causes IBS? Number one factor, the food that you take. The kind of food we eat. And everybody knows in the Middle East, the food is full of fat, and it's not dietary healthy 100%, as we say it. Number two factor is antibiotic takes. The antibiotic, when it goes to your body, it kills a big, a huge, a large, a tremendous amount of the good bacteria and increases the bad bacteria. Number three factor, stress. Thank God, in the Middle East, we all have three of them. That's why we have to take this capsule to be able to get rid of the cause from the beginning. That's number one item, which is NewJersy Multidofilus. Now we're going to speak a little bit about another product. I'm not going to talk about all of our products because we have more than 300 products in our company. We're going to speak about 3-4 products and that's it. And after that, with the doctors, we're going to have a round table discussion and we'll discuss whatever they want to discuss. Number two item is NewJersy Super Joints Plus. That's for building up cartilage. By aging, by not taking a good or a proper food, people start to lose control of their bone density. That's a big problem. Now, there is the cartilage that's between the two bones. There is a liquid thing called cartilage. A lot of people, they don't know it. They will go, oh, my knee, it does hurt me so much. My back, it hurts me so much. Why is that? Because the liquid stuff here, in between the bones, by aging or by sport, a lot of people, they play sport, when they get old, it affects them. And by the food intake that you used to eat in your life, that will affect you when you become older. So, this liquid stuff in between the bones start to decrease, a little by little. And in some cases, it vanishes. When it vanishes, the bone, there is nothing to protect it. The upper bone from the lower bone. Then there's a fraction. Then the bone is not healthy. Then the bone is about to break. Then with a firm handshake, somebody could break your hand. That's the problem. What's the treatment for it? Okay. There is something called a glucosamine chondroitin. Glucosamine and chondroitin. This glucosamine comes from the shellfish. It's natural, 100% natural. Doesn't have any side effects whatsoever. Glucosamine are combined with chondroitin. It rebuilds the cartilage from the beginning in your body. In another word, when you take the tablet, 1,000 milligram and up, it depends on the doctor's prescription, but according to the WHO, the minimum dose is 1,000 milligrams. So the doctors could see a severe case, and he wants to give 2 tablets a day or 3 tablets a day. Whatever he gives, it's 100% safe. It doesn't have any chemicals. It doesn't have any side effects. It depends case by case situation. When you take the glucosamine with chondroitin, the cartilage starts rebuilding again. Somebody will ask, how long does it take? This depends on the age of the person, how severe the case is. There is some severe cases, very bad severe cases. It took them 6 months to 1 year. There are some cases modern. It took them about 3 months. There are some cases within the first 1 month, they saw a lot of benefits out of those tablets. So it depends the physical structure of the body and the age processing. So the glucosamine and chondroitin, when you are combining together, it starts rebuild the cartilage in the body. Now, we are combining those 2 important elements, ingredients, with calcium and vitamin D3. Why calcium and vitamin D3? A lot of people, they don't know that the calcium in our body is 99% of the calcium in our body is in our bones. 1% only in our blood. Just 1%. You see how flush and blood in your body goes every day, every single minute, every single second. 1% of the calcium is in there. So if you do not reinforce it, and you do not have enough calcium with your food intake, with the tablets that you take in, the blood, when it needs the calcium, starts taking it from the bones. So the bones, when it's taking it from the bones become weaker. When it becomes weaker, that's where osteoporosis and osteoarthritis starts, and all those problems. The other elements in there is vitamin D3. Vitamin D3, all of us knows how important it is, and how a lot of people, they cannot get vitamin D3 through the sun, especially cover-up people like most of our people in the Middle East here, and the people that they are in their offices, they're not exposed to the sun, direct sun. 15 to 20 minutes exposing to the sun a day, that will be enough to give you your need for vitamin D3. But unfortunately, in the area here, it's very rare that somebody will get this kind of amount of vitamin D3. That's number 1 benefit for the vitamin D3 when you are combined with Super Joints Plus, NewJersy Super Joints Plus. The other important issue, calcium, it's very difficult to absorb and digest. What's the helping element in here is vitamin D3. That will help you in the calcium issue with digestion and absorption. Another product that we're going to talk about, I don't know if everybody's comfortable with, understand what I'm talking about, according to the products. Anybody has a question or something? Or we'll leave it up to later on if you want. Okay. Now we have NewJersy L-Carnitine Plus. This is mainly for fertility. That's a very important amino acid. It's an amino acid product, L-Carnitine Plus. The NewJersy L-Carnitine Plus is made of L-Carnitine tartrate. That's number 1 element, and this is the most important ingredient in the L-Carnitine. Number 2 is vitamin E, vitamin C, and niacinamide. Let's talk about L-Carnitine first. There are several kinds of L-Carnitine. We have L-Carnitine tartrate, acetyl L-Carnitine, and so on and so on. The most pure L-Carnitine that you could use is L-Carnitine tartrate. Why? Gives you 100% of the active ingredient to benefit your body. The acetyl and the other L-Carnitines, it gives you 50%. For an example, 1,000 milligram of L-Carnitine tartrate, it gives you 1,000 milligram of active ingredients, good active ingredient. 1,000 milligram of acetyl L-carnitine, 50% of it is sold, disposed, and 50% it goes to your body. That makes it 500 milligram. So tartrate versus other ingredients, tartrate is the best kind that you could use to get the full benefit of the active ingredients of the L-carnitine. What does the L-carnitine do? L-carnitine for males increase the sperm counts, increase the sperm motility, and the volume. We spoke about the volume and the viscosity too. A lot of people, they suffer from this problem, fertility and non-fertility and such and such. The L-carnitine, when you use properly, okay, increases the volume of the sperms with a person from the first couple of weeks about 20%. Then after 3 months, up to 60%. We're talking about the volume itself. A lot of people now, they go, oh, I did a report, and I have 20 million sperm. Why I cannot fertile? Okay? People think that volume is the only issue with fertility. If you have 60 million, not 20 million, if you have 60 million sperms and you have viscosity, you won't be able to fertile. So they have to be combined. Volume, viscosity, motility. That's very important. Motility is the movement of the sperm itself around the oval. So these 3 elements, L-carnitine boosts them. Okay, get rid of viscosity, motility is fast, and the volume is huge. Right? Now, a lot of doctors, and there are a lot of them among us here, they prefer to prescribe with L-carnitine, vitamin E, vitamin C, and niacinamide, which is true. Those elements are very important too in the fertility issue. In spite of the end consumer takes 4 tablets, L-carnitine, vitamin E, vitamin C, niacinamide. We are combining 1 tablet, all of those active ingredients. In spite of the consumer will pay such amount of money for 4 tablets, they will pay 1 price only. And the most important thing, what's most important than that, is the incipient. Of course, everybody knows that when we form a tablet, we don't just bring the carnitine, vitamin E, vitamin C, and put them all together, and it becomes a beautiful piece of art, and we give it to the end consumer. What holds it together is something called incipient, such as starch and so on. Those incipients to the stomach, if they exceed a certain amount, they will cause what they will cause. They will cause harmful things to the stomach ache, stomach problems. That will. And so, in another word, instead of we have incipient for L-carnitine, bottle of L-carnitine, bottle of vitamin E, bottle of vitamin C, and bottle of the niacinamide, we have just 1 incipient, and it's less than what's recommended by the WHO, which is less than 23%, okay, in 1 tablet. In spite of the vitamin 4 tablets, 23 times 4, that's 96%. That's what you should worry at that time. That's according to the L-carnitine. We have some other use for L-carnitine also. There's diabetic patients also. Sometimes diabetic patients, they feel numb in their hands and their feet. Why the hands and feet? Because they are very far away, the farthest one, okay, from the heart. When the heart do the blood circulation, with the diabetic patient, it doesn't get to them very easily. Why is that? Because the muscle of the heart doesn't function well. It doesn't spread the blood to those places. L-carnitine stabilizes the heart muscle, and it beats in a normal way, and you'll be able to get rid of this problem. I'm not saying that you have to replace glucophage or any other product. No, that's a different situation. I'm talking about numbness only. That's for type 2 diabetic patients. Also for the heart, some people, they have non-stable heartbeat, either fast or so slow, like this. The L-carnitine itself, when used properly, stabilize the heartbeat, like this. That's very important to the L-carnitine. And now, anybody has a question among us? Doc.
What about wound healing? Does it affect wound healing?
I'm sorry, I can't hear you.
Does it affect wound healing?
Wound healing?
Wound healing.
Which one?
L-carnitine.
No, it doesn't affect it.
So it cannot accelerate.
It doesn't, what?
Does it work as, let us say, antioxidant or not?
The L-carnitine itself?
Yes.
It could be.
Has this been proven or not?
Yes, you have